What is the modality of treatment that you follow, and has it changed in any way this year?
Dengue is a virus. It will come to your body, create trouble and go away. As such, that virus does not require any treatment. Dengue does not have a specific treatment. Other viruses like HIV virus, herpes virus, they have a antiviral treatment. But dengue per se, there is no specific antiviral treatment. There is only supportive treatment. So if BP drops, you give IV fluids, saline. If platelet dropped significantly, you give platelet. But as such, there is no specific treatment for dengue fever. You need to give only symptomatic treatment. What I mean to say symptomatic treatment, that you give a lot of IV fluids, you give a lot of saline, and if other issues are there like liver issues and brain issues, you treat accordingly. Important thing that you need to maintain hydration. What I mean to say hydration, you drink a lot of water. The same thing we do when we hospitalize the patient. If he or she is not eating, there is a persistent vomiting, we give a lot of IV fluids as per sodium, potassium and other clinical parameters. And as and when you develop some complication, you treat the complication accordingly.
What is the minimum number of days that a patient needs to be hospitalized?
The criteria for our discharge, what we keep is that if the child is clinically improved, that his appetite has returned, he's drinking adequate amount of fluids, his urine output is improved, and the fever has come down, and the last is the lab parameter that the platelet count have started rising. Even if the platelet counts were say initially 30,000 and they have gone up to 50 and say next day 70, even if they are not within the normal range, but the child is otherwise clinically active, you might still think of discharging the patient. We don't have to wait for the platelet count to rise above say 1.5 lakhs. A rising trend in the platelets along with a clinical improvement, till that time the child needs to be hospitalized. On an average, as sir said, it's a viral illness which is going to last for say a week's time. The usual course is around a week. So if you get admitted on day 1 itself, you might be in the hospital for say 5-6 days. But if suppose you are on day 4 and without any complications, you will be discharged by day 3. So it depends on what time you are getting admitted, and also whether you're going to the complicated phase or you're going into the normal dengue without any complications.